The dramatic rise in COVID cases throughout the county in the past weeks, 23 ABC is taking an in-depth look at the case totals by age groups. There have been almost 166,000 cases confirmed in Kern County since the beginning of the pandemic. Of that total, 58% of positive cases stem from those between the ages of 18 and 49. Next on the list at 17% are adults between 50 and 64 years old. Third are children up to 17 years old at 16%. And last on the total list are those 65 years or older, with 9% of COVID cases being attributed to them. On the same note, the rapid rise in COVID cases across the U.S. is forcing public leaders and businesses to make tough decisions. As CNN's Alexandra reports, thousands of flights are being canceled, some schools are going back to remote learning, and health officials are expanding access to vaccines.
If you look at the upstick, it is actually almost a vertical increase.
Amid a tsunami of new COVID cases, the daily average topping 400,000 for the first time. The FDA making major moves to add layers of protection, authorizing booster shots for kids ages 12 to 15, shortening the window between the initial doses of a vaccine and the booster shot for everyone from 6 months to 5, and authorizing a third dose of vaccine for some immunocompromised children between the ages of 5 and 11. All that as the Omicron surge brings with it a growing number of hospitalizations, but at a lower rate than we've seen during other surges.
The one group that may be a problem for is very young children, toddlers, who have trouble with upper airway infections. And we are seeing rising hospitalizations among that pediatric segment.
School districts across the country now struggling with how to bring students safely back to school. 5 Metro Atlanta schools going remote for the first week of the new year, while Seattle and D.C. schools delayed their start dates to allow time for more testing. But the largest district in the nation, New York City schools, is bringing students back to class, with a new mayor committing to in-person learning.
We're not sending an unclear message of what is going to happen day to day. I'm going to tell you what's going to happen day to day. We are staying open.
It's part of a shift being seen in more of the country toward finding ways to coexist with COVID. Crowds filling stadiums for holiday bowl games. The NFL and NBA easing restrictions on players last week after so many cancellations and delays. But there are still consequences of the crushingly high case count, and it isn't business as usual.
When I say major disruptions, you are certainly going to see stresses on the system. We already know that there are reports from fire departments, from police departments in different cities that they're 10, 20, 25, and sometimes 30% of the people are ill.
New York City coping with a staffing shortage among first responders by instructing emergency medical services not to transport most stable patients with flu-like symptoms. The headaches for air travelers intensifying, a mix of staffing shortages and winter weather now causing another 2,100 cancellations today.